Welcome to The Explainer. Today, we're breaking down a condition that affects so many people but is, often really misunderstood: intermittent explosive disorder.
So, picture this. A really minor frustration, something you'd normally just brush off, suddenly feels like the absolute last straw.
If you've ever felt your anger just surge to a level that feels completely uncontrollable and totally out of proportion to what's happening, well, that's not just a bad temper. It might actually be a recognized medical condition.
Okay, let's dive right into this. What exactly is intermittent explosive disorder, or IED for short?
So, at its very core, IED is really about a problem with impulse control. It leads to these explosive outbursts that are totally unplanned. They're not meant to achieve any specific goal or anything like that.
Now, this is a really crucial point. How is this different from just, everyday anger? Well, we all get angry, right? But the outbursts in IED are on a completely different scale compared to whatever set them off.
And these are some of the clinical markers that doctors use to identify the disorder. It really highlights that this is about a recurring pattern of behavior, not just a one-off bad day.
Okay, now, what's really interesting is how IBD is managed. And the great news here is that there are clear, evidence-based ways to get treated.
Treatment usually combines two really powerful approaches. You've got therapy, which helps you build skills, and then you have medication, which can provide the support to make those skills even more effective.
CBT is super practical. It's all about learning real-world techniques, things to help you recognize your triggers, calm your body down, and choose a different response instead of just reacting impulsively.
Now, when it comes to medication, something called selective serotonin reuptake inhibitors, or SSRIs, are often the first choice. And this chart just brilliantly illustrates how effective they can be. In one key study, about 2/3 of patients, that's 2 out of 3, saw moderate to large improvement. That's huge. Let's move on and see how this all builds toward the goal of treatment. What does success actually look like?
Clinicians are usually aiming for one of two outcomes. A response means things are getting much better and safer. But the ultimate goal is remission, and that's where the symptoms are pretty much gone.
And look, this isn't a one-and-done kind of thing. Progress is monitored really closely, with check-ins becoming less and less frequent as you get more stable. It's all about ensuring consistent and supportive care.
So, what's the long-term prognosis for someone with IED? Understanding the typical course of the disorder is absolutely key.
So without any treatment, this condition can be chronic, lasting for many years. And this number, it really just underscores why seeking help is so important.
But, and this is a big but, there is hope. The journey of life itself, combined with effective treatment, can lead to a decrease in how often these outbursts happen over time.
So, here's the crucial point. Getting better is just the first step. To maintain all that progress and prevent a recurrence, treatment is often continued for a couple of years, maybe even more, depending on the person.
Okay, let's bring this all together. What is the single most important thing to take away from all this? Despite how overwhelming it can feel, IED is not a personal failing. It is a treatable disorder. Effective therapies and medications are out there to help you regain control.
If any of this resonated with you today, speaking with a professional is such a powerful first step on the path toward understanding and managing these really intense emotions.